evening. We hear a lot about breast cancer, specifically in relation to women. But how prevalent is this in men?
Good evening, Tommy. Good evening, viewers. I can illustrate this quite easily. If you take 1,000 men off the street, one of the 1,000 will develop breast cancer during the lifetime, plus minus. If you take 1,000 women off the street, 100 will develop breast cancer during their lifetime. So it's much more a problem for women than for men.
And what age group are we looking at? Traditionally, they say with women, it's around the age of 40 where breast cancer becomes a problem. What is the age for men?
We diagnose breast cancer in men commonly between ages 60 and 80. And for women, it's much earlier a problem, and especially in inherited breast cancer, it can become a problem. The youngest person that I've seen with breast cancer was 16, whereas the youngest man I've seen with breast cancer was in his 40s. And
what are the causes of breast cancer?
In men, we find quite often a genetic predisposition to breast cancer. That means gene abnormality that gives you a high chance of breast cancer. And we then look at the women, whether in the family, whether they also have inherited this abnormality, because in them, the risk of suffering breast cancer during the lifetime is much higher. Let me illustrate that. If we're talking about the very well-known breast cancer gene 1, that also Angelina Jolie had an abnormality in, then the chance of breast cancer for women is virtually 90%, whereas that for men is much less. It's somewhere around 5 to 10% during their lifetimes. If we're looking at breast cancer gene 2, we find that the risk of women to suffer breast cancer during their lifetime is somewhere between 60 and 80%, whereas for men it's around about 10%. But since breast cancer in men is so uncommon, we find in them quite often a genetic predisposition that allows us a view on the women.
Now, I believe, Doctor, that there are different types of breast cancer, so one cannot talk about homogeneous breast cancer. Talk us through the different types of breast cancer and which ones are more prevalent in men and in women too.
Yes, most common breast cancer are the so-called luminal types. And these are types that are dependent, or at least partially dependent, on the hormones. They make up around about 40% of all breast cancers. The other ones are the triple-negative breast cancers that are not dependent on hormones and that do not express a certain protein on the cell surface. These are usually very aggressive cancers. In contrast with the luminal A's and B's, and they cannot be treated by hormones, and they are not dependent on hormones. Then we get so-called HER2-positive cancers. Once again, it's a subgroup of cancers that's growing quite aggressively, but in recent times, we've had the introduction of biologicals into treatments. These are drugs that attack specifically the HER2-positive cancers, and what previously was very much incurable has become a curable disease. This is about 20% of breast cancer. The triple negatives are 20% of breast cancer. The luminals are about 40% of breast cancer, and the rest, the last 20%, are made up out of a mixture. And for lack of a better categorization, we call them luminal Bs. They are partially dependent on hormones. They have somewhat of the aggressiveness of the triple negatives, and some of them you can treat with biologicals. In total, I must say that we have seen that breast cancer has become a very curable disease from early detection, which is a very important contributor to improved therapies. I think whereas something like 30 years ago, out of 8 people with breast cancer, out of 100 people with breast cancer, about 80% would die of their disease. It's nowadays the other way around. Out of 100 people with breast cancer, only 20 will die of their disease if treated appropriately and diagnosed early.
And talking about early diagnosis, what are the symptoms of breast cancer in both men and women? And as you answer that, if you could also touch on the testing mechanisms. I think, women are quite au fait with how to test for breast cancer as far as, the touching of the breast, etc. But what are the diagnosis treatments for men, the processes for men?
Well, we men don't like to touch ourselves. That is the first problem. That is natural. Men don't have the same health-seeking behavior as women have. However, most of the cancers that we see in men, obviously due to the rarity, there is no screening program for breast cancer men. So most of the men that we're seeing with breast cancer come to us because they feel a lump in the breast. And since there's relatively little breast tissue, it's very easily palpable. Now, also due to the fact that there's relatively little breast tissue and usually relatively little subcutaneous tissue, which is often fat and muscle, surrounds the breast tissue, the breast cancers, even though they are small, already invade the muscle and the skin and the surrounding fatty tissue, so they spread relatively easily, whereas breast cancers in women usually are contained for a while in the breast. Now, if you're looking at the principal treatment methods, they are the same for men and for women. That means that we would consider an early breast cancer surgery first, meaning a mastectomy, due to the small size of the average male breast. Breast conserving therapy is not an option here. And I must say, quite self-evidently, for us men, the breast doesn't have the same sexual connotations as for the women and the same body image implications. So I don't think that you will find it great news to you, but I've never done a reconstruction at a male breast, whereas standard-wise, in case we're doing a mastectomy in women, we always talk with the patients about reconstruction. Then the second local treatment option is radiotherapy, and we very often employ this in men because once the tumor has invaded the skin or the surrounding tissues, especially the muscle, then they recur locally easily, and radiotherapy diminishes this chance. As second big group of treatments, next to the local treatments, we have the so-called systemic treatments that treat breast cancer elsewhere in the body. And like in women, most of the tumors in men are dependent on hormones, namely estrogen. Yes, women also have estrogen. We have a sulfate of testosterone. That's why we like to make war. And women have more estrogen. That's why they are that's why they are more feminine. But women also have estrogen, and we treat breast cancer with anti-estrogens. If we're looking at chemotherapy, the same regimens are used in men as in women, and for biologicals, the same holds true if we encounter a HER2-positive breast cancer in men. In summary, one must say for men it holds the same holds true as for women. If detected early, it's curable.
This is a phrase that's used a lot, Doctor, early detection. But what exactly does it mean? How early is early enough?
Yes, for women, we prefer to have the breast cancer detected at screening mammography. And if we do this at screening mammography, then the survival of the woman is going to be the same as a woman without breast cancer. As I explained earlier, due to the rarity of breast cancer in men come to us with lumps in their breast. I think if you feel a lump in your breast, just go to a doctor and have it checked out. And that will still be early enough to cure you. But don't wait until it's broken to the skin or it's fixed to the chest wall, because then it's actually too late. or if you feel lumps underneath your armpits, then it becomes relatively late in the date, and cure becomes a distant possibility only.
You mentioned, doctor, some of the causes of cancer, and genetics was one of the factors. What are the other risk factors for cancer in men and women?
We have come to realize that breast cancer is actually pretty much a lifestyle disease. And if you have a look at the hardcore genetic predispositions, they give you only about, let's say, 5 to 10, perhaps 15%. We now do very extensive genetic testing of breast cancer. The other 85% are due to obesity, alcohol abuse. In men, the proportion of genetic breast cancer is a little bit higher. We're talking here, depending on which population you're testing, in between around about 1 in 5 women, 5 men will have a genetic abnormality that leads to the breast cancer. But for the rest, this is usually lifestyle disease, lack of exercise, obesity, alcohol abuse. These are main contributors to breast cancer. There's also a little bit of smoking. Then other lifestyle decisions that you cannot influence, like, for example, late childbirth in women. Obviously, the men, we don't get children, so we don't have that type of factor. And breastfeeding, again, one thing that we men generally don't do. And, those are the main risk factors.
Are there any foods that one can consume which will perhaps help prevent one getting breast cancer?
The answer to that is ja nee. And that's a typical good South African expression, meaning it is not the food types as such that are detrimental and give you a high risk of cancer. It's more the quantity. And obesity is the biggest risk factor that we're seeing. Just to give you an idea, if you're normal weight versus if you're obese, your risk of suffering breast cancer increases by about 50%. So while there is no distinct food that you can eat or drink, there is how much you eat or drink and how much you exercise that influences your breast cancer risk to a much bigger degree.
Well, Dr. Justus, thank you so much for that. Certainly a wake-up call, and as you once again reiterated, that early detection is key. That is Dr. Justus Apffelstaedt, a specialist surgeon.